So first important complication of gestational diabetes is risk of a macrosomic baby. Macrosomic means large size baby or birth weight is 4 or more than 4 kgs. So this is the one of the most common complication of gestational diabetes. The second most common complication is neonatal hypoglycemia, means the low blood glucose level at the time of birth. As we know that in gestational diabetes, the blood glucose level of mother is more than the recommended range. This high blood glucose level will be transferred to baby through placenta, and high blood glucose level in baby will stimulate the beta cells of the baby to produce more and more insulin. And insulin is a growth factor. So these babies have more weight and more size. So because of that, when they are delivered, the level of insulin level is high, but suddenly there is an abrupt cutoff of supply of glucose from mother to baby. So there will be mismatch between the high insulin level and the low glucose level. Because of that, they are at high risk of development of neonatal hypoglycemia. It is recommended that after birth, they should undergo the frequent breastfeeding and frequent blood glucose monitoring. And if they are showing any signs of hypoglycemia like abnormal crying or abnormal body movements, they should be managed in ICU under the supervision of a pediatrician. The third important complication of gestational diabetes mellitus is neonatal respiratory distress syndrome, means the difficulty in breathing at the time of birth, because there is a high level of insulin in the body of baby, and this high level of insulin interferes with the formation of surfactant. Surfactant is a molecule that helps in the opening of lung alveoli. So high level of insulin, low level of alveolar surfactant will lead to the inappropriate opening of the lung alveoli, and there will be difficulty in the breathing. The fourth important complication is polycythemia and jaundice. As these babies are at high risk of developing respiratory distress, so they have a hypoxia, means the level of oxygen in their blood is low. This hypoxia stimulates the bone marrow of baby, leads to increased production of RBC. But these RBCs are not functionally mature, so there is also an increased breakdown of RBC. That's why these babies may present as prolongation of a normal physiological jaundice. Sometimes we may need to admit them for a prolonged time and may need to give phototherapy. The fifth important complication of hypoglycemia and gestational diabetes in mother is shoulder dystocia. As the size of the baby is large, there is a high risk of getting obstruction of shoulder of baby behind the pubic bone of mother. Because of that, the plexus of nerves in underarm may get compressed. This plexus of nerves we name as a brachial plexus, and this is known, the compression of this nerve plexus is known as apoplexy. So these babies may have a paralysis of the upper arm by birth because of their large size. That's why it is recommended that if the size of the baby is large, these females should undergo the cesarean section to decrease the risk of shoulder dystocia or paralysis of the arm.